Welcome to Heart Matters. I am Sarah Adesuyi, a health practitioner student studying at Walden University, titled Heart Matters Coronary Artery Disease. When the heart goes hungry, where we translate complex cardiovascular science into everyday understanding, and today we're exploring coronary artery disease, the world's leading cause of death. Let us break down how it develops, why risk factors matter, and how both biology and lifestyle shape outcome. The disease mechanism leads to the spectrum of ischemia. Coronary artery disease, or CAD, begins with endothelial injury in the coronary arteries. This triggers inflammation, LDL cholesterol deposition, and plaque formation. Over time, plaques narrow the arteries, reducing blood flow and oxygen delivery to the heart muscle. When demand exceeds supply, ischemia occurs, manifesting as angina or, in severe cases, myocardial infarction. In early stages, ischemia may appear only during exertion, such as climbing stairs when the heart demands more oxygen. But if a plaque ruptures, the exposed necrotic core triggers clot formation, potentially blocking the artery completely. Within minutes, cardiac muscle cells begin to die. This is a heart attack cited from American Heart Association 2024. This pathophysiology links cardiovascular physiology, oxygen delivery, vascular tone, myocardial demand, with systemic processes like lipid metabolism and inflammation. It also demonstrates interrelationships with other systems, such as immune activation and metabolic regulation. There are factors to venture into when it comes to genetic blueprint, starting with non-modifiable risk factors. Some risks are beyond our control, such as age. Risk increases as vessels stiffen and repair mechanisms decline. Genetics and family history. A first-degree relative with early CAD raises baseline risk significantly according to American Heart Association 2024. Biological sex. Men are at higher risk earlier, while women's risk rises after menopause due to declining estrogen protection. These non-modifiable factors highlight the importance of vigilance and early screening. Here are the modifiable risk factors. Prevention in action. Here's where prevention shines. Hypertension damages vessel walls. Diabetes accelerates atherosclerosis. Smoking promotes endothelial dysfunction. Obesity and physical inactivity worsen lipid profiles and blood pressure according to American Heart Association 2021. Diet high in saturated fats and sugars increases risk. Social determinants of health, like access to healthy food, safe spaces for exercise, and healthcare, also shape risk. The American Heart Association 2021-2024 emphasizes lifestyle interventions, balanced diet, regular physical activity, smoking cessation, and blood pressure control. Statins and antihypertensives are evidence-based tools when lifestyle alone isn't enough. The interrelationships happens to be the bigger picture. CAD doesn't exist in isolation. Chronic kidney disease worsens cardiovascular outcomes through shared pathways of inflammation and vascular calcification. Diabetes links metabolic and cardiovascular systems, amplifying risk. This interconnectedness means managing one condition often protects the heart in conclusion. So while we can't change our age or genetics, we can take charge of lifestyle and medical management. Coronary artery disease is preventable, treatable, and manageable when we understand the balance between modifiable and non-modifiable risk factors. Thanks for tuning in to Heart Matters. Stay informed, stay healthy, and keep your heart strong. This is an assignment for NURS 6501 Advanced Pathophysiology at Walden University, taught by Dr. Sion.